Dr. Julien here, your friendly orthodontist. Think about getting braces? Hold up, here are the top 5 reasons why braces might not be for you. From severe gum disease, to weak enamel, to short dental roots and beyond, certain factors can make orthodontic treatment more challenging, or even risky. But don't worry, there are ways to overcome these obstacles, and I'll explain how. So before you take the plunge, find out if braces are really the best choice for your smile, or if you might need to prep your oral health first. Stick around, and this info could save you time, money, and even your teeth. Periodontal disease, also known as gum disease, is a chronic infection that affects the tissues and bones supporting the teeth. It begins with inflammation of the gums, called gingivitis, which can progress to severe stages if not treated. At advanced stages, periodontal disease causes the breakdown of gum tissue and bone, loosening the structural support around the teeth. This weakened foundation can complicate orthodontic treatment, as active inflammation in the gums increases the levels of inflammatory molecules like cytokines, which accelerate bone resorption. And this bone loss limits the support necessary for the orthodontic movement. And this can shift teeth's center of resistance, which means that it can lead to uncontrolled tipping rather than controlled movement. However, with proper periodontal therapy, we can often bring the gums and bones to a healthier state. Scaling and root planing is the first line of defense, helping to remove those bacteria and tartar from those root surfaces. After initial therapy, patients may undergo maintenance cleanings for every 3 to 4 months to keep the inflammation under control. In cases where bone levels are severely compromised, adjunct therapies like LANAP or laser-assisted new attachment procedure have shown promise in regenerating bone and improving periodontal health. Tooth decay and poor oral hygiene are other common contraindications for orthodontics. Active decay weakens the structure of the teeth, making it very challenging to bond orthodontic brackets securely, while plaque buildup around the braces can actually lead to further decay and gum inflammation. Poor oral hygiene increases the risk of demineralization, white spots, and gingivitis. During the orthodontic treatment, this risk is even higher because of the additional surface area provided by the brackets or the aligner attachments. Fortunately, restorative care can strengthen the decayed teeth, while improved hygiene practices can help reduce these risks. Tools like electric toothbrushes and water flossers have been shown to improve plaque control significantly. Additional fluoride rinses and varnishes can also strengthen the enamel and protect against demineralization, helping to create a healthier environment for braces. For patients with systemic conditions like diabetes, stabilizing these medical conditions is critical for safe orthodontic treatment. Working closely with a healthcare provider to help control your blood sugar levels, for example, can help enhance bone metabolism, making orthodontic tooth movement safer and more predictable. According to a review by Al-Kabaz et al., the well-controlled diabetic patients did not exhibit any greater risk for orthodontic complications compared to non-diabetic patients, underscoring the importance of managing systemic conditions to eliminate contraindications. For patients with TMD, management of the symptoms before starting orthodontics can be a key. Treatment options like splint therapy or physiotherapy can help stabilize TMD. Splints, for instance, helps in repositioning the jaw and reducing the strain in the joint, which can improve jaw muscle coordination. Research by Manfredi et al. Suggests that splint therapy can reduce symptoms in 70 to 90% of the TMD cases. Once the TMD has been stabilized, orthodontics may even help improve jaw alignment and reduce TMD symptoms over time. Patients with short dental roots can also face challenges with orthodontics, as shorter roots have a less surface area for bone anchorage and also increases the risk of further root resorption when force is applied. This is especially relevant for patients who may already have some level of resorption from previous orthodontic treatment or due to genetic predisposition. Studies, including one by Mirabella and Artun, have shown that root resorption rates can be higher in patients with pre-existing short roots. Nonetheless, orthodontic treatment can still be possible by using gentle forces, monitoring root length through periodic x-rays, and closely managing the treatment duration. Additionally, using lower force levels and reducing treatment time are effective strategies for minimizing the resorption risk. Advanced imaging like CBCT can be helpful to track the root health throughout the treatment as well, allowing for early intervention if resorption is detected. When patients have bone loss, orthodontics can still be an option, with the help of adjunctive therapies. Periodontists may use bone grafting to rebuild lost bone or growth factors to help stimulate bone regeneration. For example, PRF, or platelet-rich fibrin, has shown promising results in enhancing bone density and support around the teeth, which is critical for stable tooth movement. Aroka et al. 2019 found that PRF treatments improved both soft tissue and bone quality around the teeth affected by periodontitis, increasing the likelihood of successful orthodontic treatment. For certain cases, limited ortho treatment may also be an option. For example, if a single tooth is sticking out, or maybe if there's minor lower crowding, we can target these specific areas with shorter, gentler treatment that addresses your concerns while minimizing the risks to oral health. So while some health conditions might seem like obstacles, many of them are relative and can be managed with the right treatments and precautions. Periodontal therapy, restorative dentistry, advanced hygiene tools, and collaboration with healthcare providers can set you up for a healthy, safe, and successful orthodontic experience. So if you're considering orthodontics and want to address any of these concerns, talk to your orthodontist. They can guide you through the options, helping you prepare for the best results. Thanks for watching, and don't forget to like and subscribe, and drop any questions below. See you next time. Annyeong.
Bye-bye.